Hi, I'm Dr. Claudia Kim, cosmetic surgeon here at New Look New Life. Today we're talking about pectoral implants. It's a highly specialized procedure designed to enhance the shape, definition, and symmetry of the male chest. If you've ever wondered how this surgery works, who it's for, and what recovery looks like, let's break it down in a clear and simple way. So what exactly are pectoral implants? So pectoral implants are solid, medical-grade silicone implants that are placed in the chest to enhance the contour and projection of the pectoralis major muscle. They're not filled like breast implants for a female chest. They're actually harder, sculpted, and shaped to look and feel like natural muscle. So female breast implants are also round or teardrop shape, while the pectoral implants can range from a rectangular or square or oval shape. This procedure is ideal for men who have a naturally flat or underdeveloped chest, or they want more definition through the upper chest, the upper pole, or they struggle to build muscle in this area despite working out like crazy, or need reconstruction correction after injury or a type of congenital asymmetry. During the consultation, we'll talk about your goals and your ideal chest shape, your workout habits, any asymmetry or muscle imbalance, and whether implants or fat grafting or a combination of both will give the most natural result. Good candidates for the surgery should have stable weight, good pectoral muscle tone, at least at baseline, and realistic expectations. How does the surgery or the procedure actually work? So pectoral implant surgery is done under general anesthesia, so you're sleeping, and takes about an hour and a half to about 2 hours. And during the surgery, an incision is made in the natural crease of the armpit, so there's no visible scars on the chest. A very precise pocket is created underneath the pectoralis muscle and above the pectoralis minor, so they're sandwiched together. And the implant is custom selected with the patient during the preoperative planning, or you can actually refine the implant to match the chest dimensions during the surgery itself. And it's placed securely into the pocket to create that natural fullness and definition of the chest. And after you close the armpit incision, a surgical tape or dressing is applied, and you have to wear a compression garment for a period of time. And because the implant sits under the muscle, it looks and moves naturally, especially during physical activity. So what are the implant options? So again, there are different shapes and sizes depending on your individual goal. So there's anatomical or contoured implants for more of like a natural athletic definition, or oval or rectangular implants for more of that upper chest width, or there's custom carved implants for asymmetries or Poland syndrome when there's a congenital underdevelopment of the chest, or for reconstructive needs. So, and all of these implants are solid silicone, so they do not rupture or leak as potentially female implants can. What about the recovery process? Most patients go home the same day, and in regards to what to expect, patients will feel the mild pressure or tightness in the chest for about 3 to 5 days. You do have to limit your arm movement in the first week, so no jumping jacks. And most patients can return to office work in about 5 to 7 days. You can resume light cardio at about 2 weeks, and actual chest workouts can be resumed at 6 to 8 weeks once the implants are stable. And patients will see that final definition at about 8 to 12 weeks as the implant settles. And the compression vest is typically worn for about 4 weeks to minimize the swelling and keep the implants in the proper position. So let's talk about the risks and complications. As with any surgery, there are potential risks, and these include infection, seromas or fluid buildup, implant shifting or asymmetry, scar tissue of the chest or even the armpit area, temporary numbness in the chest or armpit, and very rarely hematoma or bleeding or capsular contracture where scar forms around the implant. So choosing a trained, experienced surgeon is the biggest factor in reducing these complications. In regards to results, so pectoral implants really do provide a stronger, more sculpted upper chest, and you get that permanent fullness and definition, and you can see improved symmetry and an enhancement that still looks and moves naturally. So whether you're looking for a subtle athletic contour or a larger, more buff or swole-like chest shape, the outcome really is customizable. Thanks for watching. Pectoral implant surgery is a powerful option for men who want a more defined, confident chest, especially when genetics or old injuries have limited their muscle development in that area. If you've ever considered this procedure, come in for a consultation. We'll talk through your goals, examine your chest anatomy, and create a treatment plan uniquely tailored for you. If you like these educational videos, give me a like and follow. And remember, beauty is personal, but confidence is powerful.